Namaste and welcome to our FB Live session. The phrase common bowel diseases is an umbrella term used to define various diseases that affect the digestive system, leading to digestive discomfort. Some of these diseases are genetic, while others are caused due to external factors such as infections. Common bowel diseases affect either the large or the small intestines, and to understand more on this particular topic, common bowel diseases, we have with us our expert, Dr. Preeti, consultant gastroenterologist at Apollo Hospital's Greaves Road, Chennai. She will discuss the most critical topics such as their types, their causes, symptoms, and what are the various treatment options available today. Welcome to our FB Live session, Doctor. So, what are common bowel diseases and what are they?
When you say bowel diseases, bowel implies intestine. Intestine comprises of the small and the larger intestine together. So, like you said at your introduction, it is a very, very huge topic, encompasses various disease processes and disease conditions. Just to make it very simple, let's divide bowel disorders into two types. One is functional and one is organic. Functional is when there is no obvious abnormality found either through blood testing, imaging or endoscopic procedures. However, patients continue to have troublesome symptoms. Organic bowel disorders comprise of diseases which will have a background problem or in medical terms, pathology. This can be hormonal, this can be related to the lining of the bowel, this can be related to multiple associated disease conditions. However, you are able to identify one or more specific reasons that cause bowel disorders. So to keep our discussion fairly simple, we broadly discuss bowel disorders as functional or organic.
So, splitting them into functional and organic, can you drill down and tell us what are the different functional bowel disorders that are very common in general public today?
See, when we talk about functional bowel disorders, most important is the fact that one has to rule out any other possible identifiable cause before finally coming down to functional as the cause of the symptoms that the patient has. So the common functional bowel disorders that we do see are including the common IBS or the irritable bowel syndrome. This can be of various types. It can be a constipation predominant irritable bowel or a diarrhea predominant irritable bowel or the mixed type where there's alternating constipation and diarrhea. This is one of the commonest functional bowel disorders that we see in outpatient practice and possibly a very distressing one, eventually undergoing so many evaluations to land at this diagnosis. However, a very good clinical history and examination and clinical acumen makes it much easier to diagnose this. One need not go through a whole battery of tests to identify the same. Other functional bowel disorders that we see very commonly is the bloat phenomenon. This is mainly attributed to disorders or inefficient metabolism in the small bowel. So excess flatulence, bloating, these are all common distressing symptoms that patients come to us with. These are the common functional bowel disorders. Then functional constipation. Now there are various medical criterion to decide whether this is an irritable bowel or just habitual constipation. Constipation is a very less spoken about but highly prevalent problem, more so in women. And this also compromises quite a significant portion of functional bowel diseases. In short.
And when it comes to organic bowel disorders, doctor?
Now, organic bowel disorders are when there are actual clinical pathologies or diseases that cause or contribute to this. Some of the common things that all of us hear about now with so much of exposure to media and the internet is inflammatory bowel disease. As the name suggests, inflammatory means there is something wrong happening in the machinery of the intestine. Now, IBD or inflammatory bowel disease can affect both the small and or the large intestine. And now I think general public also has developed a very good awareness, which is good because now we're able to diagnose these diseases earlier than say the case about a decade or two ago. The two common ones that we are aware of are Crohn's disease and ulcerative colitis. Crohn's disease is a chronic inflammatory bowel disease. It can affect a person starting anywhere in the digestive tract, starting from the mouth to the anus. That is how wide it encompasses. Whereas ulcerative colitis is largely confined only to the large bowel or to the colon. These are the main types of inflammatory bowel disorders of a benign or a non-cancerous etiology. There are multiple other types of inflammatory conditions or organic bowel disorders, such as short-lived infectious colitis or infective enterocolitis, drug-induced bowel disorders, drug-induced colitis or drug-induced enteritis, and enteritis or colitis, that is inflammation of the small and large intestine caused due to immune suppression or with patients who are on long-term immune suppressing drugs. And of course, now not as common as before, bowel disorders which are related to diseases such as HIV or AIDS. These are all the benign conditions. When it comes to malignant bowel disorders, as the term implies, it means cancer. So cancer can affect a person anywhere starting from the small bowel to the large bowel. However, the small bowel cancers are very, very rare for reasons that are specific to the medical fraternity. However, large bowel cancers can occur anywhere starting from the rectum to the last part of the large intestine. These are in short the types of organic bowel disorders.
So, what are the symptoms of these organic bowel disorders, doctor? Not restricting it to inflammatory, malignant, or benign. In general, what are the red flags for us to understand?
What you've termed is exactly right, red flag or the alarm signs, where the clinician must be move on to further diagnostic procedures or investigations. Red flag symptoms include significant weight loss, abdominal pain, loss of protein or protein energy malnutrition, blood in stools, other associated symptoms such as significant joint pains, redness and itching of the eyes, skin rash, all these in association with the primary bowel symptoms should push the clinician to think of an organic pathology. When patients are relatively well preserved or do not exhibit any of these symptoms, one can wait or even conservatively treat before moving on to invasive testing.
So, doctor, one common question that most people ask us is, are bowel disorders genetic? Do they pass on from the parent to the child?
While most functional bowel disorders here, in fact, where genetics has been well studied is in IBD or inflammatory bowel disease. But what we found over years of research treatment is that these are all multifactorial with a genetic component. So if you were to look at patients with inflammatory bowel disease, there is an autoimmune component to this as well, multiple factors that propagate the disease. So if you really look into family history, you might find other family members with other autoimmune disorders. The common things that one should look out for are someone with rheumatoid arthritis or multiple joint pains, patients with low backache or what we call in medical terms sacroiliitis, or thyroid issues, eczema, psoriasis. All these autoimmune disorders can be seen in association with inflammatory bowel disease, which is why there is a genetic theory that is attributed to the same, but it is not technically inherited from generation to generation, but it is very much seen in families. Similarly, there are cancer oncogenes also, especially with cancer in the young, colon cancers in the young, where family screening, even with children, adolescents, is of utmost importance to pick up diseases early. So there is very much a genetic basis for both inflammatory bowel disease as well as malignant pathologies.
So, apart from the genetic concept, who else is at risk of developing these common bowel disorders?
Like I said, nowadays most bowel disorders, let's put aside malignant, if you're talking about benign bowel disorders, it is multifactorial. So it is genetic, it's environmental, it's toxin mediated, it is diet mediated, and what we call the immune flora of the bowel, or the spread of the different kinds of bacteria in the intestine. Now there are millions of bacteria in the large intestine, and the number keeps decreasing as we go from below above into the small intestine, and hardly any bacteria seen in the stomach. So there is a nice balance. Bacteria are happy to live peacefully amongst each other in a specific balance. And this bacterial flora, the bacterial family, varies from person to person, varies hugely from continent to continent, and varies depending on any other process that is disturbing this balance. So there is a term that we call dysbiosis. That means fighting or unhappiness among the different bacterial families. When there's a dysbiosis or an imbalance, this is propagated as one of the chief reasons for alteration in bowel habits or even in inflammatory bowel disease. So sometimes people would have also read about fecal microbiota transplant. People are wondering why somebody else's stool is being pushed into somebody else's colon. The idea may sound very gross, but there are a lot of scientific benefits that have been found in fecal microbiota transplant, because you're giving patients good bacteria that might possibly heal their intestine. Of course, there are many controversies around this. Having said that, I just wanted to bring this up because a lot of people are asking us about this.
We will come to that when we talk about the advancements in the field of treating IBS. Doctor, talking about bowel disorders, does untreated bowel disorder lead to cancer?
If you look at functional bowel diseases like IBS, no, they do not carry malignant potential. However, with the diseases such as ulcerative colitis especially, there is a small risk of cancer which is directly related to the duration of the disease or to the extent of the disease. Now, ulcerative colitis can affect just the lower part of the large intestine or the entire large intestine. Having said this, in our country and in Southeast Asia, there are several research publications on this which show that the risk of malignancy is far lesser in our subcontinent with respect to the Western diet. Again, this might be due to different genetics, different diet patterns and different flora, because the disease pattern is the same. So why is it that we don't develop cancers as much? Possibly there are more than one factor responsible for this. So this is one of the things where it is possibly, a reason precursor to malignancy in a very, very small percentage of patients. Otherwise, other bowel disorders per se do not, but there is a condition called polyposis of the colon. So where there are hundreds of polyps or, round tube structures inside the colon, this is a highly pre-malignant condition, and this is seen very much in families with a genetic mutation. These will definitely lead to colon cancer. However, they are to be operated before this happens. So there are few conditions where there is a very high propensity to a definite malignant potential. So these have to be always kept in mind.
So how do they identify it, or rather nip it in the bud? Like doing their health checks frequently, or
unfortunately, with a population like ours, a regular colon cancer screening like it is done in the West, say after the 4th decade, is not a very viable or a very practical option. But however, all patients who ask for screening, it's a very good idea after the 4th decade. But when there is a young patient with colon cancer, say in his or her 20s or 30s, one must screen the first degree relatives for the presence of colon cancer. And there are so many genetic tests that are done to determine what is the kind of genetic burden or tumor burden this patient has, and there are certain specific indications where one does family screening. And like I mentioned earlier, this polyposis of the colon, where there are hundreds of polyps in the colon, all family members have to be screened. They're rather rare, however there is a definite indication for screening in such conditions. But a regular health checkup picks up subtle things. These are important. For example, why I say this is, in Crohn's disease, it's a very indolent or a long-term disease. Symptoms can be very subtle, just failure to gain weight, or just anemia, fatigue, low back pain. These are dismissed as everyday problems. So routine health checks or even blood testing might bring forth these problems: a low protein, low hemoglobin, or some raised inflammatory markers. And one digs deeper into the patient's clinical history, you might actually pick up Crohn's. In fact, now why I want to bring this out is we are seeing an increased incidence of inflammatory bowel disease in young children, adolescents, college going. So one wonders whether it's a westernization of lifestyle, excessive stress that we carry now from a younger age. So Crohn's disease is becoming more common. One has to have a high index of suspicion for the same.
Irrespective of age.
Irrespective of age.
Doctor, you mentioned the usage of medications sometimes that could lead to bowel disorders and diseases. Can you elaborate a bit on it?
See, there are multiple medications. See, nowadays we have, with the advent of modernization and, India becoming a global power, we've also brought along so many lifestyle diseases along with us as a burden. Commonest being diabetes, hypertension, fatty liver, coronary artery disease. So, most patients now who have diabetes also have hypertension, also have problems with cholesterol, also have a fatty liver. This is what we call the metabolic syndrome, and it is a curse because patients are on multiple medications and there will be drug to drug interactions with these medications. Some of them can cause loose motions, some of them can cause constipation. Most of them are manageable and mild, but when symptoms are refractory or severe, one has to dig into the drug history to see if there are any drug interactions or any specific drugs that lead to the same. Similarly, when there are patients who are on immune suppressive drugs, they are more prone to opportunistic infections or infections by bacteria that would not possibly attack a healthy host. So all this has to be kept in mind for bowel disorders.
Doctor, we'll take some questions from our viewers. An article recently that I read said that dietary changes help in common bowel disorders. What are the other ways to treat common bowel disorders, doctor?
If you're looking at conditions like, say, constipation or IBS, diet is of utmost importance, and which is why perhaps our forefathers did not suffer as much from these. Diet which is rich in fiber, which is low in refined carbs, low in processed sugars, takeaway meals and packaged foods, going down to our roots, literally, help, because roughage is of very, very great importance in maintaining bowel health. Similarly, the use of natural probiotic, the best probiotic that one can think of is our own curd or buttermilk. You need not go out to buy synthetic probiotics to stay healthy. Exercise can never be given enough importance in the maintenance of good bowel health. In fact, scientific proof exists for colonic motility improvement with physical activity, and we always encourage our patients to be physically active. So it's a combination of diet, exercise, and even relaxation skills like yoga, pranayama. In fact, now all this is coming to the West. Hopefully, we will come back to this and reach full circle in a couple of years from now.
Hello, doctor. Are women more susceptible to developing common bowel diseases than men? If yes, why so? You had started with our discussion with that.
Women, yes, develop a higher frequency of common bowel disorders for various reasons. One being, the possibly, especially among Indian women, if you even look at papers, the sacrificial nature of the woman to give the family everything before, she takes the leftovers. Giving less time to her mental health and physical health, the immense stress she takes, like a Durga Mata, managing everything, the house. And now we have a rising number of career women who have to manage both the home and, the professional side of life. And this is universal, not only India. Gender discrimination exists even now. So I think women have a bigger cross to bear in that way, though things are largely improved. So even if you look at percentages, yes, higher frequency of functional bowel diseases exist in women, very much seen in India as well as over in the world.
My husband was recently diagnosed with IBS. What type of diet should help him relieve the symptoms in the first place?
IBS is a chronic phenomenon. There is no one-stop treatment for IBS. There is a lot of lifestyle involved. There's a lot of other mechanisms involved in IBS. There are multiple proponents of the FODMAP diet, or the fermented oligosaccharides. There are certain no-nos in your diet, and there are certain yeses in your diet. So here we mainly ask you to avoid refined monosaccharides and sugars, things that worsen abdominal bloat or flatulence. Fiber-rich fruits and fiber-rich vegetables are allowed. A lot of tubers are discouraged. Milk is discouraged by a lot of people. Personally, I don't believe in milk intolerance, but the view is divided. If not milk, I personally tell my patients to have either curd or buttermilk, because very few patients seem to have lactose intolerance in our country, at least on a permanent basis. Sometimes very difficult to convince patients to listen to you.
I have a question here in terms of coffee intake. Does coffee intake early in the morning in an empty stomach aggravate your IBS?
Coffee is rich in caffeine, we all know that. So I think it is a quantum that matters. And when it comes to IBS, no. In fact, adequate amounts of caffeine is good. It boosts your mood, helps your positive gut hormones grow. So anything in excess is harmful, be it coffee or tea. But otherwise, no, not proven to worsen IBS. In fact, it's good for fatty liver.
So we'll continue with the questions, doctor. I have a family history of Crohn's disease. Can I prevent it?
I wish that could have happened, but no. But whether you will or not develop Crohn's disease is a different matter altogether. If there is a family history of Crohn's disease, one must just wait, but there's no preventive strategies as such. But maintaining a healthy lifestyle possibly at least helps you to, delay it or mitigate symptoms.
Recently, my 50-year-old mother was diagnosed with intestinal obstruction. How severe is it, and can medications help?
When you say intestinal obstruction, obstruction means block. There is some place where the intestine cannot move. So there are multivarious causes for intestinal obstruction. Some of the commonest causes are what we call adhesive obstruction. Those are caused by previous operations or surgeries on the abdomen, where the intestines can stick to each other or kind of twist around, in which case there's a kink and a block to the movement of the intestine. There are many other causes. Some of them can be strictures or narrowing of the intestine. This can happen in inflammatory bowel disease or patients who have radiation therapy for abdominal cancers or cervical cancers. Then there can be tumors of the intestine, small or large bowel, tumors. There can be malignancies or cancers, large polyps. These are all some of the common causes of intestinal obstruction. Sometimes, depending on the nature, they can be conservatively managed, especially if they're caused by bowel adhesions. Most other causes will require surgical exploration and treating of the cause.
My 10-year-old has severe acid reflux and has several episodes in the last 2-3 months. Can this lead to IBS?
See, when we have functional disorders, they can happen in the foregut or the food pipe and the stomach. They can affect the small intestine, they can affect the large intestine. While there is no direct relationship to GERD and IBS, they all come under the large spectrum of functional disorders of the gastrointestinal system. One leading to the other is difficult to say, but if there is a component of stress and lifestyle disorders that are leading to this, one may at some point not evolve but also lead to another, but there's no direct relation to the two.
So keeping a constant check is always.
I think teaching our children to eat healthy, exercise healthy from a young age is the order of the day, so they grow up to be healthier adults.
My friend complains of bloating, nausea, bad breath and abdominal cramping. Could it be a sign of a bowel disorder?
If all these symptoms are short-lived, if they're self-limiting and there are no red flag signs like weight loss, loss of appetite or decrease in hemoglobin, this could well be just dysbiosis or maldigestion, in which case it can be appropriately managed with certain digestive enzymes, lifestyle manifest changes. But anytime you have these red flag signs, something as simple as belching could also imply an ominous problem in the stomach like a malignancy. One has to take a very clear clinical history to decide on further evaluation.
So what would be your message to our viewers today, doctor?
The bowel is a large organ, and there are multivarious problems that one can have when your bowel plays with you. Component of bowel disorders even today is functional bowel disorders. So a healthier lifestyle, healthier diet and a better awareness of one's body might help in reducing these symptoms. And one must never take their symptoms lightly if they're troublesome. Please visit your doctor if you experience unexplained fatigue, swelling of your lower limbs, abdominal pain of a different character, weight loss. These are all red flag signs. Do not take them lightly. Do not attribute them to anything else. Visit your doctor so we can treat you early.
Thank you very much, Dr. Preeti, for clarifying and explaining all we needed to know about common bowel diseases. For appointments with Dr. Preeti, consultant gastroenterologist, Apollo Hospitals, Greaves Road, Chennai, please contact 044 4040 1066. I repeat, 044 4040 1066. Thank you very much, doctor.
Thank you.